Assalamualaikum warahmatullahi wabarakatuh, and good morning to Doctor and my fellow friends. We are from Group 12, so today we will be presenting regarding to case study 4 for nutrition therapy assignment. So our group member is Noda Mira, Wong Lily, Au Jing Yui, Nik Fasiha, Nur Izzati Nabila, and Nur Ashikin. So for the first question is to identify the clinical sign of malnutrition noted in this patient. Okay, first, Jane, 55 years old, a mother of four, who was diagnosed with stage 2 colon cancer, and her current weight is 51 kilogram and height is 158 centimeter. So for clinical sign of malnutrition, first, loss of appetite, which is decreased intake of food or meal, and next is normal albumin level, which is 4.3 gram per dl, and next is low hemoglobin level, which is 11.6 gram per dl, which is normal hemoglobin level for women is 12 to 16 gram per dl, and next is weight loss, which is loss of weight 5 gram in 3 months, which is her initial weight is 56 kilogram and her current weight is 51 kilogram. Next is dry mucous membrane of mouth, caused by exacerbation for dysphagia. And the last is dysphagia, which is difficulty to swallow foods or liquid, which cause decrease intake of food and meals.
The next question is briefly describe the potential effect of cancer and its treatment on a patient nutritional status. The first is diarrhea, is the impair of functioning of the disaccharide and reduced absorption of nutrients. Constipation is abdominal distension or discomfort, which can cause decrease the appetite, easy fatigability, and irritable mood. Drugs have been found to be strong correlated with constipation. Highest for calcium channel blocker and least for antiarrhythmic. Anorexia, low weight is maintained poorly by starvation. Xerostomia is affect the consumption of food intake, and hydration with require patient increase blood injections to 25 to between 25 to 30 ml per kg per day. Anemia is leading to iron and other nutritional deficiencies such as folate and vitamin B12, which can cause acute or chronic bleeding, systemic inflammation, metastatic infiltration of bone marrow, and therapy-related myelosuppression. Practice is poorer nutritional status, such as those with lower body weight, lower body mass index, and lower hemoglobin level were more fatigue. And nausea and vomiting is interfered with the food intake and with the patient activity level. Dysphagia can cause dehydration, weight loss, malnutrition, and choking, fearful of eating, and reduce the enjoyment of food. Changes in taste and smell can cause loss of appetite, and also radiation therapy reduce the number of taste buds. Loss of appetite can cause the loss intake of food and induce the weight loss. Stomatitis is occurrence of oral complication which need to take soft food that are easy to chew and swallow.
Question 3 is about nutrition care process for colon cancer patient. Okay, based on Jane's nutritional assessment anthropometric, her current weight is 51 kg, her initial weight is 56 kg, and her weight lost before diagnosis is 5 kg. Her BMI is normal, which is 20.4 kg per m squared, and her biochemical assessment is her hemoglobin level is normal, which is 11.6 gram per deciliter, and her albumin level is also normal, which is 4.3 gram per deciliter. Her clinical assessment is Jane has colon cancer stage 2 and dysphagia. Physical signs such as dry mucous membranes of the mouth have likely exacerbated her dysphagia. And her dietary assessment is assuming Jane's activity level is moderately active and her BMI is normal. Her energy requirement is 1,750 kilocalorie. Her protein requirement should be 87.5 gram, which is equals to 350 kilocalorie. However, her energy and protein intake are lower than normal based on her diet history. Nutritional diagnosis. Jane has low intakes of calcium, vegetables, high fiber grains, and carotenoids. Cooking using charcoal grilling method can cause higher risks of getting colon cancer. Jane also has problems swallowing certain foods which related to her losing weight due to dysphagia.
For nutrition interventions, physical activity, provide education on importance of exercising. The physical intervention of multimodal rehabilitations is exercise training. There are three main categories of exercise, which are aerobic, resistance, and flexibility training that complement each other and lead to a comprehensive functional outcome improvement. Dietary intake. Patients also need to be educated on nutrition intakes such as meet energy requirement and consume high protein diet. Dietary therapy aim to achieve a daily protein intake of 1.5 gram per kilo of ideal body weight. Good quality proteins from poultry, fish, dairy, eggs, and plant represent the first line sources, whereas supplementations should be prescribed only if needed. The ratio of carbohydrate, meat, or alternative protein sources and vegetable in a balanced diet is 2.1.2. Basic dietary recommendations such as limiting high-fat foods, favoring whole grain goods, limiting sugar-rich foods with low nutritional value, limiting alcohol intake, or eating meals at regular hours with current intervals should be taught to the patients. Dysphagia, she should follow instructions regarding diet consistencies and swallowing techniques provided by speech pathologists to reduce dysphagia symptoms. She needs to eat soft, moist, and pure foods, but uniform consistency is best, as opposed to chunky soup and stews. Eat smaller, more frequent meals and snacks. Use commercially food thickeners, tapioca, flour, instant mashed potatoes, rice cereals, or cornstarch to thicken liquids advised by speech pathologists. She must avoid eating bread, cake, cookies, and crackers, or soak them in milk, juice, gravy, or sauce before eating. Monitoring and evaluations. For follow-up care, Jane must maintain healthy weight, practice healthy eating, and be physically active. She has to do physical examinations and CA testing for every 3 to 6 months, abdominal and chest CT scan each year, every 6 to 12 months for people with high risk of recurrence, and colonoscopy 1 year after surgery.
Okay, next I will present about meal plan and dietary strategies for colon cancer patient. Okay, the daily energy requirement needs by Jane from the Harris Benedict calculation is 100 1178.40 capsule per day, while ambulatory patient calculation, she have mild starvation, which is 1.3. The normal range is 0.85 to 1.0. So from that, the energy requirement needs by Jane is 1531.92 kcal per day, which is 1532 kcal per day. Okay, she's macronutrients requirement for protein is 61.2 gram based on 1.2 gram protein per kg. Okay, so the protein percentage in daily requirement is 16%. Okay, for the carbohydrate, she needs 54% of carbohydrate, which means 207 gram from her daily requirement. Fat is 30%, which means 51 gram. Okay, for the food exchange, we plan that she takes 2 serving of milk, 3 serving of fruits, 4 serving of cereals, 3 serving of veggies, poultry is 1 serving, fish is 3 serving, fat is 6 serving.
So next we go to meal exchange for Jane. So for milk, Jane must to consume for breakfast for 1 serving and supper also for 1 serving. Fruit, she need to take during morning snack and evening snack and also dinner. And then for cereal, Jane must to take for breakfast 1.5 serving and also lunch also 1.5 serving. And for dinner is 1 serving. Then for veggie, Jane must take during breakfast, morning snack and dinner for 1 serving. And for poultry, she need 1 serving for lunch. And for fish, she need 1.5 serving during lunch and also dinner. And for fat, she need 2 serving for breakfast, 2 serving for lunch, 1 serving for evening snack, and 1 serving for dinner. So this is a menu suggestion for Jane. Mealtime during breakfast, she need 1 glass of milk, 3 slices of wholemeal bread and margarine, half cup of dark green leafy vegetables, and also plain water. For morning snack, she need 1 whole apple, 5 ketul cucuk ikan bilis with a veggie and plain water. And for lunch, she need 3 cup of plain porridge, 1 cup of chicken soup, 1.5 piece of fried salted ikan tenggiri, and plain water. For evening snack, she need 1 bowl bubur cha-cha, 1 cup of plain tea. And next for dinner, Jane must to take 1 cup of rice, 1.5 medium of fried ikan kembung, 1 bowl of vegetable soup, 1 slice of watermelon, and also plain water. For supper, she need 1 glass of milk. So this is a dietary strategies for Jane. Jane must follow the instruction regarding diet consistency and swallowing technique that provided by the speech pathologist. Next, Jane also must to eat soft, moist or puree foods in uniform consistency and must to eat smaller and eat frequently for meals and snacks. And besides, Jane must avoid eating breads, cakes, cookies, gravy, and juice before eating. And Jane must to try ice or popsicles before a meal to stimulate the swallowing reflex as advised by the speech pathologist. So this is a references. Thank you.